This research paper explores the use of conversational assistants to help heart failure patients manage their salt intake by answering questions about salt content in foods. The study compares two systems, one built in-house using a neurosymbolic architecture, and another based on ChatGPT, a large language model. The goal is to evaluate their performance through a user study with African American patients, who are at higher risk for heart failure and often need reliable information on diet. Conversational assistants have been around since the early days of natural language processing. For instance, in 1966, a program called ELIZA simulated a psychiatrist by responding to user inputs. Over time, these systems have evolved with advances in machine learning and datasets, and more recently, with the capabilities of large language models like ChatGPT. In healthcare, they help with tasks such as providing information, answering questions, and supporting patient education. The paper highlights the need for careful evaluations, especially in high-stakes areas like medicine. Traditional task-oriented dialogue systems are typically measured using metrics like intent recognition accuracy and slot filling, which assess how well the system understands and tracks user goals. However, systems based on large language models, like ChatGPT, don't fit neatly into these categories because they generate responses more freely and aren't always transparent about their data sources. This lack of transparency and potential for errors makes human evaluation essential, particularly in healthcare where accuracy can affect patient outcomes. The authors point out that large language models might not reliably follow prompts or stay within task boundaries, which is a concern for real-world applications. In this study, the focus is on African American patients with heart failure. These patients often need to monitor salt intake closely because they are more susceptible to the condition and may face barriers like limited access to healthy foods. Research shows that during educational sessions, they frequently discuss salt and food, underscoring the demand for tools that provide quick, accurate information. The researchers developed two versions of a conversational assistant. The first, called HF Food NS, uses a neurosymbolic architecture. This means it combines neural networks for handling language with symbolic reasoning for logical processing, allowing it to answer queries about salt content in a structured way. The second, HF Food GPT, is based on ChatGPT and relies on generative AI to respond to user questions. They conducted a within-subject user study, where the same participants interacted with both systems. This design helps compare the systems directly by having each patient use both and provide feedback. The study involved patients asking about salt in various foods, and researchers measured aspects like accuracy, task completion, verbosity, speech errors, and the need for clarifications. The results showed that the in-house neurosymbolic system, HF Food NS, outperformed ChatGPT in several key areas. It was more accurate in providing correct information about salt content, completed more tasks successfully, and was less verbose, meaning it gave shorter, more concise responses. This could make it more efficient and less overwhelming for users. On the other hand, the ChatGPT-based system had advantages too. It made fewer speech errors, such as mispronunciations or unnatural phrasing, and required fewer clarifications from users to complete tasks. This suggests that while it might not be as precise, it could feel more natural in conversation. Interestingly, when patients were asked about their preferences, there was no clear favorite between the two systems. This indicates that factors like accuracy and efficiency might balance out with aspects like ease of interaction and naturalness. The paper draws from a broader context of dialogue system evaluation. For traditional systems, metrics like slot accuracy and joint goal accuracy are common. But for AI-based systems, subjective qualities like coherence and user satisfaction are harder to measure automatically. That's why human evaluations, including surveys before and after interactions, were used here. These provided insights into both intrinsic performance, how well the systems handled tasks, and extrinsic factors, like overall user experience. The authors reference previous work, such as a survey by Valizada and Pard from 2022, which analyzes healthcare dialogue systems from a computational perspective. They also mentioned studies on heart failure in African American communities, noting higher sensitivity to salt and the importance of dietary management. For example, a study by Gupta and colleagues in 2020 found that salt and food are frequent topics in patient education sessions. Overall, this research underscores the trade-offs in using different AI architectures for healthcare applications. While neurosymbolic systems offer reliability and precision, large language models provide flexibility and a more human-like interaction. In the context of heart failure management, empowering patients with accurate, accessible tools could lead to better health outcomes, but it requires balancing technological strengths with real-world usability. The study also touches on ethical considerations, like the risks of misinformation from generative AI in medical contexts. As conversational assistants become more popular, evaluations like this one are crucial for ensuring they meet the needs of diverse user groups, particularly underserved populations. By comparing these two approaches, the paper contributes to ongoing discussions about the role of AI in healthcare, emphasizing the value of controlled, stakeholder-involved studies to highlight both advantages and limitations. This work could inform future developments in designing safer, more effective conversational tools for patient support.